Hello and welcome back to Chapter 3 of Anatomy and Physiology for the Prehospital Provider. And this time we will be going over the 113th slides for the skeletal system. Let's get right into it. We've got our learning objectives. First things first. Describe the function of the skeleton, explain how bones are classified, and give an example of each. Explain how joints are classified, give an example of each, and describe the movements possible. Describe the embryonic skeleton. Describe how it is replaced by bone. State the nutrients necessary for bone growth. Name the hormones involved in bone growth and maintenance. Explain what is meant by exercise for bones and explain its importance. Identify the two major subdivisions of the skeleton and list the bones in each area. Composed of 206 bones, its connective tissues are associated with the bones to make up the support of the framework. This is cartilage, tendons, and ligaments, and virtually every muscle in the body is attached to the bones. You can test it out for yourself. Feel yourself. You've got all of these muscles, all of your forearm muscles are connected to each and every bone. Your ulna, your radius, especially right here. You can feel it. It's connected. Muscle contractions result in movement, especially when you flexion and distension, which is what we learned in chapter 1 and 2. Bony structures provide protection for vital organs. It serves several vital metabolic functions: the production of blood cells and platelets, and the regulations of serum levels of calcium. So cartilage, tendons, and ligaments. Cartilage, tendons, and ligaments are important connective tissues that work with bones to provide the support and framework with the skeleton. The cartilage is that shiny connective tissue that are lubricated by the synovial fluid and provide a slippery surface over which bones may move freely. The synovial fluid is the transparent viscous joint fluid that is secreted by the synovial membrane. Also, in other words, when you crack your fingers, that is the release of synovial fluid from the cartilage. So that's a new fact. There are several types of cartilage. Hyaline cartilage is the type most commonly associated with joints. Perichondrium cartilage is the double-layer connective tissue membrane that surrounds the cartilage. Specialized tendons are specialized tough cords or bands of dense white connective tissue, continuous with the periosteum of the bone. Periosteum is the double layer of membrane that covers all bones except the articular surfaces. This connects the muscles once again to bone. Ligaments are tough white bands of tissue, and they bind bones together. Collagen. Tendons, they are composed of densely packed fibers of collagen and twisted in a rope-like protein. Ligaments, the collagen fibrils are often less compact. The ligaments are often more flattened than tendons, forming sheets or bands of tissue. Sprains are caused by the stretching or tearing of a supporting ligament due to the partial or temporary dislocation of the bone ends, or the joint surfaces generally fall back to the alignment. And for joints, the points are where the two bones come together. Movement occurs when a muscle contraction causes the tendon to pull on a bone, resulting in a motion at a joint. Strains occurs when a muscle is stretched or torn, resulting in a pain, swelling, and bruising of the surrounding and soft tissues. No ligament or joint damage occurs with a strain. It is possible to have a strain and a sprain at the same time. I've had both. I've had all of the above. It's painful. Sprains and strains are generally graded based on their severity and physical findings during examinations. We got a list here, once again. So we've got grade 1, which is minimal damage, all the way up to grade 3, complete destruction of the muscle, tendon, or both. You can actually see it with bodybuilders when they do curl-ups. you can see their muscles just tear and it folds all the way back. It snaps. It looks so cool. Guess check it out. Anyways, enough of that. Classifications of bones. Long bones, they are longer than they are wide and include most of the bones of the upper and lower extremities. This includes the femur, tibia, radius, and ulna. Here you can see where this is located. Short bones, as broad as they are long and often are cube-shaped or round. This includes the wrist or foot. Flat bones are relatively thin and flattened. This includes the ribs, sternum, or scapulae. You can see here the carpals are actually kind of it's controversial. They're kind of like flat bones, kind of like short bones. To be honest, I don't know if they fit in that category, but they kind of qualify as flat and short. Parts of the bone, epiphyses and physes, which is the epiphyseal plate, and metaphysis, perodosteum, and the endosteum. Diaphysis. Yeah, it's diaphysis. The shaft of a bone containing the medullary cavity. You can see here the medullary cavity. Did they not show the medullary cavity? Where's the... I don't think they show the medullary cavity. Because I know what it looks like. Nope, guess I don't show it. Bone marrow, there's yellow marrow and red marrow. They do, I believe, show the yellow marrow right in here and the red marrow. Continuing on. Two main types of bone: compact bone, mostly solid with few spaces, and cancellous bone, consists of a lacy networks of trabeculae. Trabeculae are bony rods oriented along the lines of stress to increase the weight-bearing capacity of the long bones. Lamellae are oriented around the caniculi in units called osteons. The Havarian systems are interconnected by a series of vessels called perforating canals. And some of these words I've literally never seen before, such as caniculi. I've heard of lamellae, but I just haven't seen that in a while. But here we have the diagram, red marrow and spongy bone. And here, how it shows how those lines are actually vertical quite often. Two types of bone growth. Appositional growth, which is the formation of bone on the surface of bone. And then endochondral growth. Oh my gosh, my tongue. Which is the growth of cartilage in the epiphyseal plate and its eventual replacement by bone. Bone remodeling is the changes in shape of bones as an individual grows are due to the removal of old bone and the deposition of new bone by osteoclasts. Joints are articulations, junctions between bones, and classified as to how they move and according to the types of tissue binding bones together the joint. We can see here an entire picture of a bunch of joints. There's the planar gliding joint right here, shown in between the vertebrae of the spine, which you don't think is a joint, actually. I've heard a lot of people think when you say, "Oh, my spine hurts," some people say that's not a joint problem. Well, sometimes it is. There's a slightly movable joint, articulation between two adjacent vertebrae, which is right here in the not the metacarpals. I'll think of the word later. There's the saddle joint, which is the movement of the right angles with the thumb. You have that saddle joint. Some people can dislocate that. I've seen that's pretty cool. The ball and socket, we all know that. You can dislocate that. The hinge joint, you've got the immovable joint, which is the first pair of ribs and the breastbone. Apparently, that's also a joint. You can dislocate that as well. A lot of things you can dislocate in life and in your body. So joints, they're classified as immovable, synarthrotic, slightly movable, are Amphiarthrotic and freely movable are diarthrotic. Fibrous joints lie between bones that are closely contact with each other, joined by thick, dense connective tissue, and they have no real movement. Cartilaginous joints are connected by hyaline cartilage, which is fibrocartilage. They include the joints that separate the vertebrae, and they have slight flexibility. Synovial joints allow free movement, more complex than other joints, and the outer layer of ligaments, inner lining of synovial membrane. Some have shock-absorbing fibrocartilage pads, which is menisci, and may have fluid-filled sacs, which is bursae. Correct me if I'm wrong. Synovial joints classified as ball and socket joints, condyloid, ellipsoidal joints, gliding or plane joints, hinge joints, pivot joints, or saddle joints. Growth and development of bones. Bones begin to form in the utero during the first 6 weeks after fertilization. Intramembranous bones originate between layers of connective tissues that are sheet-like in appearance. Unspecialized connective tissues form at the sites where future bones will be developed. Osteoblasts develop. Extracellular matrix sounds the osteoblasts, making them osteocytes, and surrounding the membrane tissue begins to form the periosteum of the bone. Osteoblasts form a compact bone layer over the new spongy bone, and endocrinal bones begin a cartilaginous masses. They develop from hyaline cartilage. They grow rapidly at first and then change appearance. Spongy bone begins to replace cartilage, and primary and secondary ossification. There's a lot of terms for ossification. Ossification is the growth of bones. You'll see it a lot. There is a disease which is known as fibrodysplasia ossificans progressiva. Stem root ossifica. And it is where your muscles turn into bone. It's a pretty cool disease, very rare. Bones increase greatly in size as fetus develops throughout childhood. Growth continues through adolescence. Ossification is the process of replacing other tissues with bone. Usually, this is the way it's done, but in some diseases or in some other genetic code malfunctions is what we call it. This is sometimes not the case. Osteogenesis is the formation of bone. Endocrinal ossification is development of long bones from hyaline cartilage, and this begins with the diaphysis at the end with the epiphysis. Intramembranous ossification is the process in which flat bones are formed, like your rib cage, developed from connective tissue membranes that are replaced by spongy bone, then compact bone. Physis is epiphyseal plate, where the diaphysis met at the epiphysis while bones are growing. Also the growth plate, and made up of 4 cartilage layers: the reserve cartilage, proliferating or the hyperelastic cartilage, the hypertrophic cartilage, and the calcified matrix. Growth of long bones depend on good nutrition and several hormones: the human growth hormone, which is HGH, thyroid hormone, estrogen, and testosterone. We all have testosterone, believe it. Once the physis closes, the long bones can no longer grow. Osteoblast and osteoclast is activity and balanced in the body so the bones grow uniformly and proportionately. Here we've got a graph of how this sort of occurs. So we've got the bone of the epiphysis, the zone of the reserve cartilage, and then the zone of the calcified mix. It sort of grows like that. You'll understand it if you sometimes you just got to cram information in your head and you'll get it soon enough. Bone development, growth, and the repair are influenced by nutrition, hormones, and exercise. So this means the bones store materials, and the bones have a role in forming blood cells and platelets. Bones consist of collagen and hydroxyapatite. Hydroxyapatite is a compound that contains calcium and phosphate. Collagen lends flexibility to bones. And yes, bones have flexibility. Vitamin D helps the body absorb calcium, and exercise stresses the bones. Calcium-rich foods, vitamin D, and exercise help maintain good bone health and help prevent osteoporosis. Fractures. I love this. I love this. This is my favorite picture already. Fracture is the breaking the bone. This is actually called a puncture fracture wound, or that's kind of what wilderness first aid called it. It's probably not the actual medical term, though. Fractures, the repair process. Upon fracture, the damaged blood vessels release blood that forms a blood clot. Within days, fibroblasts secrete proteins and collagen to form a network of connective tissue between broken bone ends. Chondroblasts produce cartilage within the network. Calluses are the zone of repair, and osteoblasts form surrounding normal bone invade the area to form cancellous bone trabeculae. Bone remodeling occurs and the cancellous bone is replaced by the compact bone. Healing is usually complete 4 to 6 weeks following the initial injury. Closed fracture occurs when the bone is fractured, but the bony ends have not penetrated the skin. Open fracture is when the skin is over fracture and penetrated. When the skin over the fracture is penetrated. From the inside out, when the bone protrudes through the skin. From the outside in, when an object penetrates the skin and fractures the underlying bone, and it's susceptible to infection. Open and closed fractures, either type of fracture may be non-displaced or displaced. The type of fractures, there's grain-sticked, communicated, pathologic, epiphyseal, oblique, transverse, spiral, and incomplete. Incomplete here, you can actually see right here. That's an incomplete. Incomplete's not all the way cut through. Human skeleton, axial versus appendicular. Axial. Appendicular. The axial skeleton supports the head, neck, and trunk. Skull, the top of the axial skeleton, consisting of 28 bones, or 3 anatomic groups of bones, auditory ossicles, cranium, face, and the sutures of the joint where the bones come together in the skull. Mandible, the lower jaw, only movable joint bone in the skull, attached to the cranium by ligaments. Paranasal sinuses help the voice to resonate, reduce the weight of the skull. Here you see the coronal suture, xiphoid bone. You can also see the mandible, lateral. This is the lateral view. This is the posterior view, and this is the mitigatal view. You can all see all the sutures, they lie. There are much more than you actually think of. We've got big plates, but we also have smaller underlying cracks. This is the inferior view, so you can see the bottom layer of teeth where the tongue would rest at a relaxed position and where the spine would come into the brain, or the spine would enter into the what I call the head space. Anterior view, we've got the mandible once again. Remember, the mandible is the only thing that can actually move in the skull. Cranium, this is made up of 8 bones that encase and protect the brain. We've got the frontal, parietal, occipital, which is the foramen magnum, the temporal, sphenoid bone, and the ethmoid bone. The frontal bone forms the anterior skull above the eyes and contains the frontal sinuses above the part of the eyes. So this is this entire part right here. This is kind of like when people take your temperature nowadays with the whole COVID thing going on. They're supposed to take it from the frontal to the temple. Not everyone does that correctly, but correct them if they get it wrong. Say, gotta go from the frontal to the temple. The parietal bones, located on each side of the skull behind the frontal bone, right here. They form the sides and the roof of the cranium, and they fuse in the middle along the sagittal suture. They meet in the frontal bone along the coronal suture. The occipital bone joins the parietal bone along the lambdoid suture and forms the back of the skull and the base of the cranium, so basically the back of the head. Foramen magnum is the large opening in the occipital bone at the base of the skull where the brain connects to the spinal cord. Temporal bones join the parietal bone on each side of the skull along the squamous suture. External auditory meatus is the opening that leads to the ossicles and the inner ear structures. The ossicles are the 3 small bones in the middle ear. The mastoid process is the cone-shaped section of the bone that is a site for muscle attachment. Temporal bones are the styloid process. This attaches to muscle in the tongue and the pharynx. Zygomatic process. This helps form the cheek. The sphenoid bone forms part of the base of the cranium, the sides of the skull, and the floors and the sides of the eye orbits. Sella turcica is an intended portion of the sphenoid bone that contains the pituitary gland. The ethmoid bone is located at the front of the sphenoid bone. This forms a mass on each side of the nasal cavity, joined by thin cribriform plates that partially form the roof of the nasal cavity. This is sort of where they, when they test you for COVID, they basically stick it all the way up to your brain. They stick it up to the nasal plate, basically to the base of your skull, joined by thin cribriform plates that partially form the roof of the nasal cavity. This is perforated with numeral foramina for the passage of olfactory nerve filaments from the nasal cavity. The ethmoid bone, or the ethmoid bone is there's crista galli, a triangular process between the cribriform plates that attach is to membranes, the meninges that encloses the brain. Parts of the ethmoid bone form pieces of the cranial floor, walls, and the eye orbits, and wall of the nasal cavity. A perpendicular plate forms most of the nasal septum. The facial skeleton is the maxillae, forms the upper jaw, interior roof of the mouth, the hard palate, floors of the eye orbits, and the nasal cavity, sides, and the floor, containing the upper teeth sockets as well as the maxillary sinuses. Palatine processes of the maxillae grow together as the body grows and fuse to form the anterior hard palate. I've been reading it wrong. Oh my god. Facial skeleton, maxillae continued along with the alveolar process. The alveolar arch, dental arch, is formed where the teeth are bound via dense connective tissue. Zygomatic bones are the cheeks and lateral walls and floors of the eye orbits. Nasal bones fuse at the middle to form the bridge in the nose. Vomer bone joins the ethmoid bone to form the nasal septum. The anterior nasal conchae support the mucous membranes of the cavity. Lacrimal bones are located in the medial wall of each eye orbit. Palatine bones form the posterior hard palate and nasal cavity floor, as well as the nasal cavity lateral walls. The mandible projects upward at each end at the mandibular condyle at the carotid process, and articulates with a temporal bone right here, which is why it feels so good to rub it, because there's muscle connecting at both ends once again. Provides attachments for the muscles needed for chewing, contains the hollow sockets for lower teeth, and the only movable bone of the facial skeleton. Infant cranial bones. The cranial bones in infants are connected by fibrous membranes through fontanelles that allow the cranium to slightly change shape. Compresses to facilitate passage through the birth canal, and they close as the cranium ossifies and the bones grow together. The spine is the vertebral column, or the spine. This serves as the vertical axis of the human skeleton, extends from the skull to the pelvis, and comprised of 24 bony vertebrae separated by intervertebral discs made of cushioning cartilage connected by ligaments. Each vertebrae has a drum-shaped body, making up the thick interior portion of the bone. The spine. Look at this. It's pretty cool, right? We've got here, remember the C7? You know, the C7, the thing you're not supposed to break. Anything from the C7 and up, you break that, you're paralyzed. Congratulations. There's the thoracic vertebrae from T1 to T12. People also check that, especially when you're in a head or neck injury related event. Lumbar vertebrae, you check that if you're worried with a hip injury. You want to make sure you're A-OK. There's the sacrum from S1 to S5, and then you've got the coccyx, your tailbone. People break those all the time, and it's also an evolutionary factor that said that the coccyx was a failed tail to form for us. So kind of interesting and cool. Between the vertebrae, intervertebral discs between each vertebral body is the mass of fibrocartilage consisting of annulus fibrosus and nucleus pulposus. So annulus fibrosus is the exterior fibrosis ring, and nucleus pulposus is the internal gelatinous mass in the center of the disc. Intervertebral foramen is the hole between each vertebrae through which spinal nerves pass from the spinal cord. Remember, this is the intervertebral disc is also what is known as a joint. For the vertebral column, this supports the head and the trunk, protects the spinal cord. Some vertebrae are fused at the bottom to form the sacrum and the coccyx or whatever. Pedicles are thin, hard plates that are the posterior portion of the border of the spinal canal, and also laminae. Vertebral arch, posterior portion of the vertebrae that contains bony processes, facets, and pedicles that surrounds the vertebral foramen. Intervertebral forama, openings formed by the notches that align with adjacent vertebrae through which spinal nerves pass. Cervical vertebrae. There are 7 cervical vertebrae located in the neck. There's the Atlas C1, the first vertebrae located directly beneath the skull. This provides support for the head. There's Axis C2, second vertebrae, point at which the head rotates. Atlas rotates around the axis, and the dens has this. The thoracic vertebrae has 12, which I mentioned before. The vertebrae have long transverse processes that, along with the vertebral bodies, articulate with the first 10 pairs of ribs. Lumbar vertebrae, comprised of 5 vertebrae, located at the lower back, larger than thoracic vertebrae, support more body weight. We've got the sacrum, composed of 5 fused vertebrae. Tubercles project outwards with rows of openings through which the nerves and blood vessels pass. Sacral hiatus, I guess, openings through which the sacral canal passes. 4 pairs of anterior sacral foramina allows nerves and blood vessels to pass. We've got the coccyx, or the tailbone, composed of 4 fused vertebrae and is attached to the lower portion of the sacrum. The thorax cage includes 12 pairs of ribs, the sternums, and the costal cartilage. Remember, we've also got our floating ribs here. You can pull on them. Try. It's really cool and fun. We've got thorax. Supports the pectoral girdle and upper limbs, protects the visceral organs inside the thoracic and upper abdominal cavities. The sternum, which is the breastbone, and which is the part you rub when you check for alert and responsiveness. And it has 3 parts, the mandible, middle body, and which is the gladius, and the xiphoid process, which if you punch in well, you can kill somebody because it will pierce the ascending vena cava. Don't ask me how he knows this. You've got the ribs formed by 12 pairs of ribs. The true ribs, the upper 7 pairs of the ribs articulate with the thorax vertebrae and the sternum. Got the 8th, 9th, and 10th pairs of ribs that are attached to the cartilage that attaches to the sternum. Do not reach the sternum directly. You've got the floating limbs, the remaining 2 pairs of ribs that are held in place by cartilage and have no attachment to the sternum. You've got the appendicular skeleton, which contains the upper and lower limb bones and the bones anchoring the limbs to the axial skeleton. The pectoral girdle, which attaches the upper extremities to the body and consists of the scapulae and the clavicle. This is your shoulder blade, basically. Clavicle, collarbone, the ass-shaped bone at the anterior portion of the shoulder girdle, located at the base of the neck, running horizontally between the mandible and the scapulae. This holds the shoulders in place and provides muscle origination points for the upper limbs, chest, and back. The scapulae shoulder blades are triangular-shaped bones, which is the part of the posterior portion of the shoulder girdle. We've got the acromial process, coracoid process, and the glenoid fossa. The shoulder girdle is we're going to list off these stuff. The acromial process is the part of the scapula that protects the shoulder joint and provides a site of attachment for both the clavicle and various shoulder muscles. The coracoid process is another point on the scapula where the shoulder muscles and clavicle attach. The glenoid fossa is the part of the scapula where the humerus articulates. Upper limbs consist of the arm, forearms, and hands. Humerus is the upper bone in the arm, and this articulates proximally with the glenoid fossa and distally with the radius and ulna at the elbow joint. Lower portion has two smooth condyles that articulate with the ulna and radius. Humerus, the anatomic neck narrow. There's a narrow depression in the proximal portion of the humerus that separates it from the tubercles. Epicondyles, which is the distal structures that attack the muscles and ligaments of the elbows. Olecranon fossa, a depression in the posterior surface that receives an ulnar olecranon process when the upper limb straightens at the elbow. Radius, the bone on the lateral side when the arm is in the anatomic position. Radial tuberosity, which serves as an attachment for the biceps brachii muscle, and the distal portion of the radius has a styloid process. The ulna, which is the bone on the little finger side. So we've actually got this in fingerprinting too. We've got the ulna fingerprint, the ulnar loop and the radial loop. So we've got to know this too. The ulnar loop links to this side. Radial loop links to this side, based on my hand. So the bone on the little finger side overlaps the end of the humerus and has a trochlear notch at its proximal end that articulates with the humerus. The distal end has a head that articulates with a notch of the radius. The hand consists of the wrist, palm, and fingers. The wrist is composed of 8 irregularly shaped bones called carpals. Metacarpal bones are bones that form the hand. Phalanges are small bones forming each fingers. Phalanges in the fingers form hinge joints. Each finger has 3 phalanges. The thumb is an exception with only 2 phalanges. The pelvic girdle, comprised of 2 hip bones and the sacrum, attaches lower limbs to the axial skeleton. The pelvic girdle, it's got the pelvis, which is formed by the sacrum, coccyx, and the pelvic girdle. The female pelvis is usually wider than that of males, obviously for childbirth. Pelvic girdle supports, protects, and or articulates with the trunk, lower limbs, urinary bladder, large intestine, and reproductive organs. Hip bones each have 3 parts. The ilium, ischium, and the pubis fuse together into an acetabulum. The ilium is the largest portion of the hip bone, forms the prominence of the pelvis, the iliac crest, which is the margin of the prominence, the sacroiliac joint, which where the ilium joins the sacrum. There's the ligaments and the muscles that attach to a protection from the ilium. There's the ischium. It's like a German word or something. Lowest portion of the hip bone, L-shaped, supports the weight of the body when sitting, and the ischial tuberosity is the angle of the ischium, points downward and posteriorly. The pubis is the anterior portion of the hip bone, forms an angle known as the pubic arch symphysis. Pubis is where the 2 pubic bones join. Obturator foramen is a large opening between the pubis and the ischium. Lower limbs, this includes the bones of the thigh, knee, leg, and foot. You can see here, got all lower limbs right here. Femur, longest bone in the body, really hard to break, just saying, don't break it, it's really, painful. Femoral head, the topmost portion of the femur that articulates with the pelvic girdle at the acetabulum, lateral greater truncator and medial lesser truncator, where muscles are attached. The patella, we all know of this, because if you move it, it's really painful. This articulates with the femur, located in the tendon passing over the knee, lateral and medial condyles processes, where the femur articulates with the tibia. The tibia is the shin bone, larger of the 2 leg bones located in the medial side of the leg. Tibial tuberosity is the proximal process where the patellar ligament attaches. Medial malleosus malleolus. Medial malleolus is the inner prominence at the distal end of the tibia where ligaments attach. Articulates with the fibula. Fibula is the slender bone located at the lateral side of the tibia. Does not enter into the knee joint and does not bear body weight. It has slightly enlarged ends, a proximal head, and a distrolateral malleolus. The foot consists of the ankle, instep, and toes. The tarsus, or the ankle, made up of 7 bones, tarsals. The talus bone moves freely where it joins the leg bones. The tarsals connect the tibia and fibula to the foot. The calcaneus, which is the largest tarsal bone, or the keel bone. The metatarsals, the instep made of the 5 bones called the metatarsals. The phalanges of the toes are aligned with the metatarsals. Each toe has 3 phalanges. The great toe only has 2 phalanges. We've seen a similar thing of evolution with our hand. Kind of surprising. Same thing that we walked on hands and feet. So, yeah, that's basically it. Homework for you guys is to actually, I'm going to be posting, as you know, you're going to see all of the chapter bookmark, all the bookmarks and the timestamps. I want you to make a summary of each one and then make a document of it whenever you can. So yeah, that'll be it. Thank you, and hope you learned something.